All right, let's get right into it. Have you ever really thought about why some people struggle with substance use? Today, we're going to totally reframe that question. We're going to look past the idea of just an individual crisis and dig into how things like personal history, community, and, the very systems we live in all play a massive part. Okay, let's kick things off with a pretty huge idea that kind of changes everything. You see, we used to think of trauma as this, I don't know, abnormal thing, something really rare. But what science is telling us now is that trauma is actually incredibly common, a widespread part of life for a lot of people in the United States. And you're going to want to keep that idea in your back pocket because it's absolutely key for everything else we're about to cover. But hold on. Before we get to that big picture, we need to zoom all the way in. I'm talking about zooming in to the most critical life or death moment there is, a potential overdose. Because this is where having the right knowledge and a little bit of compassion can literally save a life, right then and there. So let's be super clear here. This is a full-blown medical emergency. When someone takes a high dose of an opioid, we're talking about things like heroin or fentanyl. It can slow down their breathing or even stop it completely. And when that happens, every single second counts. But here's the thing. There's a powerful tool that can completely turn this crisis around. It's a medication called Naloxone. You've probably heard of it as Narcan. Think of it like an antidote. It works incredibly fast to reverse the effects of the opioids and can get someone breathing normally again almost immediately. So what do you do if you suspect an overdose? Well, when you break it down, the steps are actually pretty straightforward. You call 911, you administer the naloxone, and you stay with the person. Now, I know what you might be thinking. Will I get in trouble? And that's a real fear. That's exactly why things like the Good Samaritan law are so important. In a place like Washington State, for example, this law gives you legal protection if you call 911 to save a life. And that is a huge deal because it encourages people to step up and help. Okay, so surviving that immediate crisis, that's just the very first step. It's so important, but it's really just the beginning. The real question is what comes next? And that brings us to the long journey of recovery, which, let me tell you, is pretty much impossible to do all on your own. Yeah, nobody can walk this path alone. And for decades, one of the most powerful and accessible ways to find support has been through community programs. It's all about that shared experience, right? It builds this incredible foundation for real healing. You've probably heard of programs like Narcotics Anonymous or Alcoholics Anonymous. They're built on a really simple but powerful idea, connection. You know what the only requirement to join is? Just a desire to stop using. That's it. They give you a kind of roadmap for recovery, and maybe just as important, they give you a community of people who actually get it because they've been there too. And when you actually look at the 12 steps, you start to see that this is about so much more than just not using a substance. It's this really deep process of self-reflection, of taking accountability, and then at the end of the day, finding a whole new purpose by turning around and helping the next person who's walking that same path. But all of this brings up a really important question. Why are these pathways necessary for so many people? The fact that these programs are so widespread, well, that tells us something profound. It tells us that this isn't just about a drug, it's about a person and everything they've been through. So to really answer that why, we've got to zoom back out. We're shifting from the what of recovery to the why, the clinical, the scientific reasons that substance use disorders even develop in the first place. And what's fascinating is that so much of the research today points to one common root: trauma. Now, it's really important we're on the same page about what trauma actually is. We're not just talking about a bad memory. We're talking about an event or a series of events that leave lasting, harmful effects on a person's physical and emotional well-being. This new understanding has led to a completely revolutionary approach in healthcare, something called trauma-informed care. And what it does is fundamentally change the entire conversation. It shifts the question away from a judgmental, "what's wrong with you?" to a much more compassionate and curious, "what happened to you?" And that small change is, well, it's everything. And the data on this, it's just staggering. There was this huge, groundbreaking study called the Adverse Childhood Experiences Study, or ACEs study for short. It drew a direct, undeniable line between trauma in childhood and health problems in adults. Get this, an adult who had 5 or more of these ACEs is 7 to 10 times more likely to report illicit drug use. 7 to 10 times. That connection is just, wow. And this chart really helps visualize what scientists call a dose-response relationship. That sounds complicated, but it's not. Basically, think of it like this.
The risk isn't just random. The more of these traumatic childhood experiences someone goes through, the higher their risk for a substance use disorder becomes later in life. It's a direct link, plain and simple.
Okay, so now we see that powerful connection between trauma and substance use. So let's zoom out even further, because a person's journey doesn't happen in a bubble, right? The systems around us, the ones that are supposed to help, can either put up huge roadblocks or they can actually provide the support people need. Here's a perfect real-world example of what I'm talking about. In Oregon, during the pandemic, a policy allowed associate-level mental health professionals to get reimbursed for their services. This was great. It opened up access to care for so many people. But now, they're changing that policy back. And according to the Mentor Research Institute, this is going to create a massive new barrier to care, especially for low-income Oregonians. Now, this single policy choice is actually part of a much bigger idea, something public health experts call the social determinants of health. It's a fancy term for a simple concept. Our health isn't just shaped by what happens in a doctor's office. It's shaped way more by the conditions where we live, learn, and work every single day. And when you look at the 5 main areas, you really see just how broad this is. We're talking about things like having a stable income, getting a good education, being able to see a doctor when you need to, living in a safe neighborhood, and having a strong social network. All of these things directly affect our health. It really drives home the point that recovery isn't just some individual battle. It's a whole community challenge.
So we've gone from the individual to the community to the systemic. Now it's time for our final, widest zoom out. And what we find at the very foundation of all of this is something we all use every single day: language. Our words.
Just let that sink in for a second. The words we choose are never neutral. They have real-world power. Our language can either build a wall that stops someone from asking for help, or it can build a bridge that helps them find it. In that sense, our words are a form of action, for sure. So, a really important idea here is using what's called person-first language. It's a simple but profound shift. We don't define people by their health condition. So, instead of calling someone an addict, we say a person with a substance use disorder. See the difference? It acknowledges that they are a person first, before anything else. And this idea applies across the board. For example, we say substance use disorder instead of substance abuse, because the word abuse carries blame. And look, this isn't just about being politically correct. It's about being medically accurate. It's about treating a substance use disorder with the same respect and scientific understanding that we'd give to any other chronic illness, like diabetes or heart disease. So, here we are. We've journeyed from a single life-or-death moment all the way out to the words we use every single day. We've seen how personal trauma, systemic barriers, and our language are all deeply connected. And understanding all these layers, well, it gives us the power to approach this whole topic with more compassion, more science, and more hope. So the only question left for all of us is, how are we going to change the conversation?